Good afternoon, everyone. My name is Catherine Brookman, Associate Director of Knowledge Translation and Exchange and co-lead of the Client Patient Handling Community of Practice at CRE-MSD. On behalf of our Director, Dr. Jack Callahan, I'd like to thank you for joining us today. We're pleased to welcome you to this webinar on Client Handling Program Resources, a Canadian scan. We would like to acknowledge and thank the Ministry of Labor, Immigration, Training and Skills Development for their funding, which supports the delivery of these webinars, as well as our presenter for sharing their expertise. Before we begin, I'd like to go over a few administrative details. The webinar is being recorded, and a link to the recording will be provided along with the presentation slides shortly after today's webinar. Today's webinar format will consist of the presentation followed by a 10 to 15 minute time for question and answers with our presenter. Please enter your questions into the Q&A feature. These questions will be relayed to our presenter, combining similar questions where appropriate. If you experience any technical issues during the webinar, please send us a message in the chat feature. Following the webinar, you will receive a link to an evaluation. This is one of our key measures of understanding the impact of our webinars, so we would greatly appreciate you taking a few moments to complete this short survey. Now it is my pleasure to introduce to you our presenter today, Sandra Excellent. Sandra Excellent is a health and safety consultant with many years of experience in occupational health and safety. She has assisted organizations with implementing comprehensive health and safety programs, developing and delivering training for staff, and conducting ergonomic assessments to optimize workplace design and reduce risk. Sandra specializes in creating detailed job demands descriptions and cognitive demands analysis to support safe work practices and accommodation strategies. Sandra has a Bachelor of Science degree, a degree in Applied Science and Occupational Health, and a master's degree in Ergonomics Human Factors. She's a registered Canadian safety professional and a Canadian certified professional ergonomist. Sandra has been working with Public Services Health and Safety Association for 17 years. Now it's my pleasure to turn over this webinar presentation to Sandra.
Thank you very much, Catherine. It's a pleasure to be here. Before we begin today's presentation, I would really like to take a moment to acknowledge and thank those who contributed to the research and development of this work. This presentation would not have been possible without the support and expertise of several individuals. First, I would like to recognize my former director, Sherry Bastos, whose leadership and guidance were instrumental throughout the project. Although Sherry was unable to co-facilitate today, her contributions were invaluable. I would also like to thank Laura Villeneuve, who initiated the jurisdictional scan process 3 years ago and laid the foundation to much of the work that followed. I would like to express my sincere appreciation to Frances Seisman, who not only served as my mentor when I first joined PSHSA and continues to be a trusted advisor, but also came out of retirement on 2 occasions to support PSHSA with research, link verification, and update to this presentation. Finally, I would like to recognize the Client Handling Advisory Group for its invaluable guidance. The group provided Frances and me with important insight on the information and resources needed to support the success of the sector as a whole. We were fortunate to have representation from every subsector, ensuring diverse perspectives and broad sector input. Their dedication, knowledge, and commitment have greatly contributed to the quality and the success of this work. Now let's begin the presentation. A little bit about PSHSA. In Ontario, the prevention system consists of the Ontario Ministry of Labour, Immigration Training and Skills Development, the MLITSD, Workplace Safety and Insurance Board, your WSIB, the 4 Health and Safety Association, and several other entities. PSHSA is one of the 4 health and safety associations, and it services various sectors, including community and health. PSHSA has 3 pillars. They form the foundation of our prevention business, bringing unique value to organizations, regardless of where they are in their health and safety and well-being journey. These include prevention training, applied and advisory services from our seasoned occupational health and safety consultants, and product as a service, such as customized assessments, audits, and so forth. Now, this presentation will explore the reason why we conducted a Canadian-wide jurisdictional scan and the topics that were explored, client handling programs and resources across the country. It will highlight the most impactful and well-developed resources identified through our review. It will look at insights into current practices related to current client handling, development of digital resources, gaps, and opportunities. Please note that the scan did identify numerous proprietary resources and products. However, only publicly accessible resources will be discussed in this webinar. These resources are to provide for educational and informational purposes only and do not constitute advice, endorsements, or recommendations. So please note the resources identified through the jurisdictional scan are provided as reference only. PSHSA did not evaluate the quality of the information and is not responsible for the accuracy, completeness, or currency of external websites and resources. Users are encouraged to review and evaluate all the information before they use it. As you are aware, client handling, patient handling, resident handling is an important hazard to address in this sector so that these injuries can be prevented. For the purpose of this presentation, we will use the term client handling to address this hazard. Definitions are absolutely fundamental to the success of any program. MSD is a hazard. A client handling MSD may occur from exposures to MSD risk factors such as repetition, force, and awkward or static posture when performing a client handling activity, such as lifting of the total weight of the body from one surface to another or a limb, transferring the weight-bearing client from one surface to another, reposition a client on the same surface, such as a chair or a bed, from one position to another. Statistics can demonstrate the magnitude of the issue and the need to control the hazard. The Ontario statistics presented here may be similar in other jurisdictions. Overall, client handling related MSDs account for 12.65% of injuries across healthcare sector. So again, this is for client handling MSDs, so not the client handling others. Hospitals reported a higher percentage of client handling MSDs, followed by ambulatory care and nursing and residential care. Social assistance reported the lowest percentage. So all of this to highlight the difference in client handling demands and associated risks across the sector. Please note that the scan was not part of a formal research project, but rather a fact-finding exercise. Some additional resources outside of Canada were also identified. Public and proprietary information was collected. However, only public information was used to develop a repository of tools and resources. And I know I've mentioned that again, and I'll probably mention it again. It's just so that you're aware that there was private information that we're not allowed to share, so proprietary, but what we have in this webinar is all of the publicly available information. So for the scan, we did a systematic review, and it was conducted in alignment with the MLITSD MSD Prevention Initiative and with an occupational health and safety lens. The initial scan was conducted in 2023 by an occupational health and safety consultant who happens to be a registered physiotherapist. And additional information was added in 2024 to 2026. Various client handling topics, resources, tools were reviewed by province and organizations within the provinces. We leveraged national resources from the scan to identify PSHSA resources gaps and to inform and update PSHSA client handling resources and tools, and to develop a robust repository of external resources and tools for sharing with clients and others. During the second review, so 2024 to 26, we invited some of our clients to participate in a client handling advisory committee in order to update our Handle with Care manual. So stay tuned in the fall and winter time for our updated information on that. Seeing as the group was interested in legislation, we decided to add this as a new topic in our jurisdictional scan. And the topics for the scan are here as follows. We made sure to keep that occupational health and safety lens while we were looking at all of the information throughout Canada, and also looking for specific frameworks as well, which I'll talk about very shortly. So the topics include legislation, client handling program development and management, client handling assessment, training resources, safety talks, safe work practices, and safe operating procedures of equipment, equipment consideration and environmental design, as well as bariatric considerations for people living with obesity. So we are highlighting the most impactful, well-developed resource that we identified through this review. Using an occupational health and safety lens, we were looking for occupational health and safety hazard program management steps, such as those frameworks like Plan, Do, Check, Act to manage the hazards. Many of you might be aware of such framework for occupational health and safety and patient care. We looked to see the trends and components in that area that was available throughout Canada. In the Plan, Do, Check, Act framework, planning means securing leadership commitment, doing a hazard identification and risk assessment and program needs assessment, really looking at what kind of equipment is needed and is currently being used in your organizations. Do they have program components? Were they detailed, and did they identify any evaluation metrics that they might measure in the check section? The Do section is the implementation piece of the Plan, Do, Check, Act. It includes communication changes and implementing the programs. All the program components in the training are put together in ongoing management of the hazards. We will talk about the image race that's to the right of the slide in the next slide. Check is looking at monitoring and analyzing the data, which is a very important part of your PDCA framework. We need to know what is working and what is not working. After you're able to look at that, you go into the ACT, which is evaluating the information discovered in the check, and then having senior management review it, acknowledge success, and make the necessary improvement. So that, in a nutshell, is your PDCA framework. We also wanted to look at more of a health and safety lens to see if there are ongoing hazard management we call RACE method, recognizing or identifying hazards, assessing hazards, including a root cause analysis, controlling hazards, and evaluating the controls after they've been implemented. Client handling programs should include corporate client handling policies, roles and responsibilities, general procedures like infection control, cleaning of the equipment, maintenance of the general ergonomics, MSD prevention, and body mechanics, has reporting, client handling, assessments, hands-on client handling techniques. So a wealth of different information needs to be present in order to have a robust program management system. We were also looking to see whether the hierarchy of control was used in the resources. This is an acceptable concept or accepted concept for controlling hazards. Engineering and administrative controls are primarily used to control client handling hazards. Some of you may not be aware that from a health and safety perspective, hazard controls are developed using the hierarchy of control. Ideally, the most effective approach is to eliminate or substitute the hazards. However, in the context of client handling, that would be illegal and definitely immoral because we're talking about people. So as a result, organizations must rely on other controls methods such as engineering controls, administrative controls, safe work practices, and appropriate equipment to reduce the risk of injury. Okay, so now on to the meat and potatoes of the presentation. So must remind you again that the following information are highlights of some of the most robust findings that are available publicly. So the way we presented the information, there are a lot of links that are there. When you get the presentation, you should be able to click on it. I'll go over some of them, but giving you a general awareness of what was found. So PSHSA makes no representation or warranties about the information, including or in respect to its accuracy, completeness, or currency. As you know, for links, sometimes they work one day and not the next. So please be mindful of that as well. Now, when we looked at the client drivers, we can see that legislation is a very serious driver. What we notice that all provinces and territories in Canada are governed by health and safety legislation and a general duty clause. So the roles and responsibility of the Internal Responsibility System, or IRS, is definitely present, primarily, again, through the roles, responsibilities, and duties of the employer, the supervisors, and the workers. And depending on the type of organizations, the board as well. We found that only two provinces, British Columbia and Manitoba, have clear, explicit musculoskeletal injury prevention and or patient handling mandates or directives in addition to their general duty clause. So hopefully that will trickle throughout Canada as a whole in the next few years. The second driver is program development and management. As it is a big category, we broke it down into subcategories. And for this slide, we're looking at program framework, program development, and implementations and policies. The elements of a successful program depends on several factors, and all of them must work together effectively. The first is development and implementation of a sustainable client handling prevention program framework. This involves much more than simply creating policies and procedures that sit in a binder and are rarely referenced. A successful program requires policies and procedures to be actively implemented, therefore living and breathing in your organizations. They're regularly reviewed and integrated into daily operations to support safe client handling practices. Policies and procedures establish the parameters and expectations for safe client handling practices. They provide clear guidance on roles and responsibilities and safe work requirements, helping to ensure consistency across the organization. They also support the effective communication of the program by ensuring that staff, supervisors, and leaders understand the organization's commitment to safe client handling and their roles in maintaining a safe work environment. The client handling program should be cyclical, with its content evaluated and improved on a regular basis and at minimum annually. Continuous review helps ensure that the program remains effective, relevant, and responsive to changing workplace needs. An essential component of the program is the ongoing systematic client handling hazard management process, commonly referred to as RACE, which we spoke of earlier. This process forms the foundation of the program and focuses on the continuous recognition, assessment, control, and evaluating of the hazards. Organizations should consistently identify potential client handling hazards, assess the level of risks, implement appropriate control measures, and evaluate the effectiveness of those controls. Through this ongoing cycle of improvement, organizations can proactively manage risk and support safer client handling practices for both workers and their clients. As part of the plan phase of the PDCA, program hazard identification and program risk assessment is important to determine areas of concerns and focus. Unfortunately, there was limited information on detailed high-level program risk assessment, and they were often very basic with the exception of resources from Alberta and British Columbia, so located on this slide. Many resources did not mention risk assessment, which is quite unfortunate. This seemed to be a gap in the resources, which is why PSHSA offers tools of program hazard identification assessment and also program client mobility needs assessment, which can identify areas of concerns and equipment program needs. We often differentiate between program hazard identification and program level risk assessment compared to the individual ongoing hazard level at the hazard level where we use RACE. So there's quite a bit of information that you'll be able to find on our website. And then there's additional information when it comes to British Columbia and Saskatchewan as well. Program components is part of the plan and do or implementation stage of the PDCA cycle. These resources were identified as comprehensive and provide a more in-depth program components resources such as sample policies, templates, toolkits that we found were easy to follow and to locate. Please note that written and documented policies, procedures, and practices, safe operating procedures, records, anything that's documented helps an organization demonstrate due diligence, particularly in the event that a ministry inspector comes to inspect a workplace to evaluate compliance to the law, or in the event of an employee or patient incident. So very important to have those policies, procedures, SOPs written down and effectively communicated to staff. BC has developed extensive resources for program components to meet legislation requirements. So in this slide, it highlights their jurisdictional scans training components and contents versus sample training videos or representation, which we'll see shortly. This again is part of the plan do part of the PDCA cycle, but focusing on the training component that needs to be in place. Client training programs should include training on corporate client handling policies, roles, responsibilities, and procedures, general ergonomics, so your MSD risk factors and prevention, as well as body mechanics, hazard reporting of client handling hazards, client handling assessments, safe operation of the equipment, hands-on client handling technique, and safe work practices for each client handling activities such as bed mobility, transfers, and such. The scan did not reveal any extensive training matrices that included all of these that I mentioned. So what we did after we identified that gap is that we developed a PSHSA, a new client handling training matrix. This slide highlights the check and act part of the PDCA cycle. Program evaluation improvement resources were less robust. However, various evaluations were identified. Very important to always go back and evaluate the programs that you have, because how else will you know if it's working for your organization, if it's been communicated effectively, trained properly, and overall preventing injuries in your workplaces. Evaluation may include main outcomes or processes measures. So looking at your policies and procedures, implementation, injuries of hazards, statistics, training records, training competencies, training completeness, and audit tools. This is a part of the program implementation. So again, we see race listed there. As mentioned, once a program is established, there needs to be an ongoing process to recognize the client hazards, assess the client handling hazards for level of risk, including identifying the root causes. Client handling hazards, control, and evaluation of client handling hazards, controls. Information review was sparse and therefore often not presented in the race format. So various sources mentioned components of race, such as identifying or assessing risk, controlling the risk. For example, the WorkSafe BC Handle with Care was very explicit, hence why there's a little star by that link. There is a lack of information on risk assessment with root cause analysis for client handling. Again, as a result, we noticed that gap at PSHSA, and Francis and I and others help create a tool that will help organizations with that, since it currently did not exist anywhere to our knowledge. So this is just additional resources when it comes to race, but again, nothing really looked at all of the different elements of race. The client assessment helps identify client abilities and risks to the client or workers. Formal assessment is comprehensive, while point of care assessment takes place just before mobilization. Considerable information was identified on client handling client assessment across Canada, with a great deal of focus on point of care assessment. We noticed that terminology was inconsistent as it varied. Example, some called it point of care assessment, some others pre-mobility assessment, bedside mobility assessment, mini assessment. However, several decision tools are available through these links that are posted on this page and the next. So you'll have information such as assessment forms, decision tools, check sheets. What I really do like is algorithms. It's always fun to look at those, are well documented, and communication tools as well. These are just some additional tools from Alberta and BC. As mentioned, client handling assessment also includes forms, algorithms, flowcharts, logos, and communication plans. Several links are shared here. We also included a repository for additional linkages of interest. So some information that you'll find here on uncooperative patients was definitely one of them. We were very, not necessarily surprised, but pleasantly happy to see that there were other types of information out there that can definitely help many organizations. There were also 2 posters that were identified from Safe Care BC and Nova Scotia Awareness, Aware Nova Scotia. And be remiss if I don't mention PSHSA also has these lovely care cards, and they process as point of care assessment to assess, should we be moving someone? We look at the communication, so their ability to understand and communicate with us. Are they resistant? Looking at their behavior and the equipment that's available. Eastern Health in Newfoundland and Labrador have a safe resident handling program pamphlet that was quite interesting as well. Safe Talks are short education sessions that can be offered by a manager, leader, trainer, champion, client handling champion, or anyone who has knowledge on client handling as a topic. Typically, it occurs at staff meetings, team gatherings, safety huddles, or it may be provided to staff for independent review. Attendance should be definitely documented as it is a form of training. As part of this review, we identified several resources. However, the number of them was limited. I think it might even be just what's on the slide there that we were able to find. Digital videos are one of the most commonly requests of many occupational health and safety safe associations. They take a lot of time to create. They're quite expensive. So it was nice that we saw and found many resources that are accessible publicly on the internet. PSHSA has included in their repository of external resources linkages that will be available on our client handling webpage by mid-July. So you'll have all of what we're presenting right now and then some available on our website. As part of this review, we identified several resources that stand out as particularly impactful and well-developed. These resources reflect thoughtful planning and collaboration. Here are some additional videos that are part of the Nova Scotian Health and Safety Authority series. BC's Interior Health Authority has developed an e-learning series on client handling assessment. So do take the time to take a look at that to see if it's something that would help your organization. Safe work practices videos are also often requested by our clients at PSHSA. Extensive videos on safe work practices and safe operating procedures of equipment, such as various transfers, lifts, repositioning, patient fall management, slings, mechanical lifts, low friction sheets, walking, and so on, are available online from many provinces. Comprehensive videos have been developed. So again, you want to make sure that you take a look at what we have on this slide so that you can see if it's something that would be beneficial for your organization. They are well-made videos. Sometimes it is difficult for us to create our own e-learning. So there are some that are available publicly, free of charge. The Interior Health in BC has developed e-learning presentations on SWP, your safe work practices, and equipment SOPs, safe operating procedures. For example, I believe topics were repositioning, mechanical lift, and specialty slings. Bariatric videos are also available. We found some through Alberta Health Services. They have developed several videos, including bed to wheelchair using a total lift, lift supported ambulation using a walking sling, lift supported repositioning, and log rolling. So they have quite a few things that you can take a look at. Under the Occupational Health and Safety Act, workplaces must develop safe work practices and safe operating procedures to protect workers. So again, it is in your Occupational Health and Safety Act, and I am certain it is in legislations if you're tuning in from a different province or from a territory. Workplaces often struggle with developing and documenting these. The above resources provide a multitude of written safe work practices for client handling activities such as bathing, shower trolley, mobility, transfers, repositioning, fall management, and emergency situations and beyond. Written SWPs and SOPs can be used to help develop training content as well. And as mentioned before, Ministry of Labor wants to see that these are not only living and breathing in your organizations, but they also want to see that it is written so that there is something in your organization that people can go back to, refer to in order to understand what they should be doing in their organization. So the two starred ones that are there, I believe it's Manitoba, both for Manitoba, are extensive resources for written safe work practices. As part of this review, we identified several helpful equipment consideration and design standard resources listed that are listed above. Two resources from Ontario, one for long-term care. And the next one is by CRE-MSD, a wonderful project that they worked on. And I'll invite Catherine to come back and share some information with us.
Thank you. Thank you, Sandra. So we had the pleasure of receiving a seed grant from CRE-MSD, the Client Patient Handling Group. And as a result of that seed grant, we were able to develop a transfer equipment resource, considerations for promoting restorative care and optimal client function. Next slide, Sandra. As a result of this seed grant, we were able to provide a webinar in 2023 that focused on this equipment table, which is actually 9 pages long, detailing a ton of equipment used for client-patient handling, providing a very useful lens for assessors to think about the impact this equipment is having on the client's ability to restore their own mobility. And information about each piece of equipment is presented with this restorative lens in mind, identifying options for the required tasks to reposition the client appropriately. And so what we were able to do with the help of feedback from people from the client patient handling community of practice was look at the movement pattern, whether it's a natural or altered movement pattern, whether the support for the client in using the equipment was minimal, medium, or maximum, whether there was a risk of loss of rehab for the client by using this piece of equipment, and the body movement required to use this piece of equipment. Next slide, Sandra. Once we got feedback from the first webinar, we refined this equipment table to add a column on the potential loss of the rehab opportunity by using this piece of equipment, whether it was low, medium, or high. So I would encourage all of you, if you haven't looked at this wonderful Ontario resource developed across and even international assistance, it's available on the client patient handling page. It's also through CRE-MSD. It's available on the MSD prevention guideline. We provide you with a recording of the 2 webinars an overview of this equipment transfer and the lens of a supervisor would use in directing their staff on what piece of equipment to use and why. So thank you for the opportunity, Sandra, to share some details about this wonderful resource.
Oh, no, thank you for jumping on and saying a few things. I know so much work went into this, so much collaboration. It really is a wonderful tool. So definitely go listen to the webinars and use that tool. Through the the scan that we did notice that there isn't that much information for people living with obesity or even bariatric considerations, I should say. So we wanted to compile some resources there. So we took a look and we did a bit of a dive into that. One thing that we noticed is it made us realize that the proper terminology changed. Bariatric patient is no longer being used, but rather people living with obesity. So what we're trying to do is make it person-centered. We're still able to use bariatric considerations when speaking about the equipment, but we definitely don't want to use that when we're looking at a person. Alberta Health Services has put together some really good information on this topic, and they have a bariatric friendly hospital initiative that you might want to take a look at if that's something you're interested in your organization. You'll want to look at the guidelines for care of hospitalized patients with bariatric care needs, and Obesity Canada has a new clinical practice guide as well. The Winnipeg Regional Health Authority resources are quite extensive and include considerations for care of obese patients. Also, bariatric patient emergency admission flowchart, bariatric equipment and supply, decision-making criteria, space requirements, and algorithms as well. Awareness, Nova Scotia, links to special considerations, provides access to several bariatric algorithms as well. And other information that Alberta Health has, it has some videos for moving those living with obesity. So how would we do that? Proper approaches. French is my first language. I would never forget my French resources. There is a wonderful occupational health and safety association located in Quebec called ASTAS, Association paritaire pour la santé et la sécurité du travail du secteur affaires sociales. They have resources under the title PDSP, that stands for Principe pour le déplacement sécuritaire de personnes, which just means client handling for those of you who do not speak French. They have wonderful documentation that is bilingual. So you can look at an administrative guide for the institutional client handling training programs, friction reducing devices, posters and reference guides, as well as videos, although I think the videos are in French, but they might have subtitles in English. So they do take a look at that resource as well. I do want to mention one thing. When you're looking at our slide deck later on and you see like here ND, ND just means there's no date. We couldn't find a date like a date associated with the information that was posted. So ND just stands for no date, and you'll see it throughout our slides. When seeking additional client handling resources, a UK resource was highly recommended to us by many organizations, many people, and not only in Canada, but abroad as well. The Guide to the Handling of People, that's also called HOP7, is an invaluable evidence-based and comprehensive written material. So we just wanted to present a slide on that. It may prove to be very helpful, useful for those seeking to prevent injuries through comprehensive step-by-step client handling assessment and safe work practices and safe operating procedures. So there are some chapters in the resource book that look at person handling practices, tasks and methods, person handling practices, weight bearing tasks and methods, and not weight bearing tasks and methods. So it really does give you that step-by-step approach. And what's important to remember is that it is evidence-based. So hopefully I haven't been going too fast for you. I want to ensure that we had time for the question period. So a few more slides left. Success of all of your prevention effort truly depend on, and you'll see it in this slide, the development and implementation of sustainable client handling injury prevention program framework, not just the development of the policies and procedures and having that in the binder, gathering dust. It needs to be living and breathing, as I mentioned a couple of times already. This set of parameters and rules for client handling promotes communication of the program. It is cyclical so that the program is evaluated and improved upon at least annually. Ongoing systematic client handling hazard management processes, such as client handling hazard recognition, identification, hazard assessment with a root cause analysis, identification and implementation of hazard controls such as policies, procedures, safe work practices, and training, hazard control evaluation is needed. This allows the client handling issues that arise to be addressed in a timely manner. Strong internal responsibility system and positive workplace safety culture is also very important. Another piece of the puzzle to make your program, to make your entire client handling journey a success, where everyone understands their legal health and safety responsibilities and workplace demonstrates a positive attitude towards client handling safety. When this occurs, safe work behaviors and practices related to client handling prevention should be observable. All of these elements, all of these elements must work smoothly and together to be effective in reducing client handling injuries in healthcare workplaces. If there is poor IRS, your internal responsibility system, and weak workplace safety culture, the prevention program and related activities to the program may be at risk and less likely to be a success. And we see that in many different hazards as well. You have heard about the IRS from the ministry, so we're just going to discuss program framework and client handling hazard management further. PSHSA has several resources to help organizations, and again, that will be available on our website. There's a plethora of useful public accessible client handling resources from across Canada in French and in English, and these vary from jurisdiction to jurisdiction. Some topics are well developed while others might not be. Legislation standards and mitigating client handling injury risk appear to be drivers for developing injury prevention initiatives and resources, so your clients and worker injuries. PSHSA's jurisdictional scan resource may be a starting point for the ongoing collation of Canada-wide publicly accessible client handling prevention resources. Opportunities exist to enhance the repository of resources and to develop a process and location for enhanced sharing and collaboration. Analysis of client handling resource gaps may assist in the identification of additional client handling program needs so that additional resources to prevent injuries can be developed, such as enhanced root cause analysis for client handling. Throughout the presentation, I mentioned documents that we at PSHSA created to fill the gaps we notice were missing when completing the scan. PSHSA updated several client handling tools to assist organizations develop, implement, and maintain their programs. A list provided for your convenience on this slide. I would wait until about mid-July, although we do have information on the link posted below this table. It is not the updated tools that we have there. Those will be available about mid-July. We'll also have new tools. And the new tools are the ones that are starred in this table. All the gaps that we found throughout our jurisdictional scan, we created some tools such as client handling training topics and considerations tools, sample client handling training matrices, client handling race and root cause analysis tool and how to use it, root cause analysis, PMAP-O, looking at the people, the equipment, material, environment, process, and other factors that could be causing or could be creating hazards in your workplace. So many different things, safe work practices, templates, list of bariatric references and resources. So many different things that you will have access to in a couple of weeks. So this is the end of the presentation. Sorry if I went by a little too quickly, but I wanted to ensure that we had time for questions and answer periods if there are any.
Thank you so much, Sandra. Really an extensive scan you provided today, and you did it with such pizzazz. A topic that could really be very dry. You made it super interesting and dynamic. A very gifted presenter, a very difficult presentation to keep people engaged. So thank you so, so much. I'd now like to invite Kim Mazzaros, CRE-MSD's ergonomic research coordinator, to lead our question and answer period.
Great. Thanks, Catherine. And thank you so much again, Sandra. That was an excellent presentation. Okay, so let's get it kicked off with questions in the Q&A. And if you have any questions, anyone on the call, please feel free to put that into the question and answer feature. So I'm just going to start off with the first one here, Sandra. Thank you for sharing such wonderful resources. Would you be able to share the resources email to participants?
Resource emails, yes. What will happen is we'll send a copy of this PowerPoint presentation, and once it's in PDF, it should still be clickable. And on our website, mid-July, we'll have a list of all of them, even the ones that we didn't list in the presentation, just in case you want to take a look. It's good to have that list in your arsenal when you're looking at client handling, and you can pull that out. Unfortunately, due to some challenges, we weren't able to upload the information for today, but by mid-July, everything should be there, nicely branded and everything. So you'll have the list of information. But when you do get the PowerPoint, listen again to the presentation, maybe a little slower, and then take notes. What I want people to do is it's a wealth of information. Don't start everything. Look at, what do I need for my organization? And start there. If we don't have a robust policy and procedure, well, I'll go to that slide. What did Sandra suggest? What did PSHSA find? And start with that. And then that will help you determine what your next steps will be.
The next question, I was wondering if anyone reached out to New Brunswick for this study. We have an extensive client handling program, including many resources, all available bilingually.
Depends on when we did the scan, 2023, and then we did some in 24 to 26. I want to say that some things aren't available publicly, or if it was and we went back to the link, they might have changed the link and we weren't able to determine where it was, because we did look at Nova Scotia, and some of them you'll see on our slide. We found great information there as well. I do want to mention that PSHSA, some members a couple of our directors sit on a committee, and they do meet with some of these entities on a regular basis. So from BC, so west all the way to east, and they meet, I think, every 2 months, and do have discussions about client handling and about just health and safety in healthcare as a whole. But I did take note of that just to make sure that I look into it. So if you don't mind, maybe even sending me an email just about that program, and my email will be in the next slide. So thank you. And I wrote it down just in case, and it's bilingual, so I love that.
Great. Thanks, Sandra. Have you found any resources on specialty topics like wound care, bowel care on a commode, walking, things for toileting, etc.?
We did find some. I don't know if I should go back on the slides. There was a slide that, sorry, I'm going to go back if that's okay.
If that's helpful, yep, that's fine.
Yeah, sorry, thank you. There was, just trying to see. You might have to send me an email, but there is in some of the training, it would have been with the SOPs. I think with the SOPs, Look at the Manitoba ones. So sorry, I know it's listed on our slide somewhere. I think the Manitoba one had some information. It might not have exactly for I don't remember seeing something for wound care, but you might be able to take some of the information when it looks at client handling, how to lift depending on where the wound, if it's the leg, if it's the arm, or if we have to actually, have the person sit up. So it will give you some information. Definitely on this page. I think it was
Perfect.
the Manitoba that had specialty information. So again, when we send all of this out, you'll be able to go back and just look at some of these links.
Sandra,
That's great.
Yes.
so any resource that, like for instance, a New Brunswick resource, or any resource that we're fortunate enough to hear about today through this presentation, we'd be able to add to this.
Oh, yes, because we
Yeah.
have what we'll have on our website as well is that list. It's a long list. It's pages and pages. I think it might have been like I want to say 20, but let's say 10 of links. So links that are not part of this presentation, but that are publicly available. What we wanted to present today was the most robust that's available publicly, that the link worked at the time of us finishing up the presentation. So it could just be that some of them we didn't necessarily miss, we just couldn't access anymore because there was some wonderful proprietary information that we do not have permission to present today. So
Thanks,
there's that
Sandra.
as well.
The last thing I wanted to ask about that is these resources are free that you've presented today,
Yes. So
correct?
what we
Yeah.
did, as I said, I only presented, or what I wanted to mention is I only presented those that are publicly available and are free. So that could be one of the reasons that you might not have noticed something that you are aware of its existence because there's quite a bit that's still available, but you have to pay or you have to get particular permission from a province or a territory.
Okay, thanks for clarifying that. All right, we have a question about how to purchase the HOP 7 book in Canada. I just see the UK website
It's only the
has
UK website.
US.
It is. That's the only way. The only way. And yes, it costs a lot of money to have it shipped.
Okay.
That's the only way, unfortunately.
All right. I'm just going to check the chat
Oh,
function.
but I
That's
do want to say it's a fantastic resource. But again, if budget is a concern, you might not be able to get it as of yet due to the shipping cost.
okay, great. In the chat, we have a couple different comments here that I just wanted to bring forward as we went through all the questions.
Mhm,
So there is an ergonomist from Quebec that
mhm,
mentioned Berry Solutions, a national bariatric solutions healthcare
mhm,
organization. So that's great. Thanks for sharing.
mhm.
We also have a comment about the Back Inform program in New Brunswick
Yes.
and the All the Right Moves program that's been
Yes.
developed by New
That is,
Brunswick.
yes.
Okay. I just have another question here in the Q&A. Thanks for the
And
great talk. Oh, go ahead,
sorry, I
Sandra.
just want to mention one thing. Some of them we didn't necessarily present it today because it wasn't good. So I'm just thinking about some of the Nova Scotia that we did present versus what we didn't present because I'm aware of them. We were really looking at the beginning of the presentation, might have missed because I was talking a little quickly. We're looking at the framework. Which one presents the entire framework that looks at Plan, Do, Check, Act so that it makes it easier for organization and that at least dips into using race to recognize or identify, to assess the hazard or potential hazard, control it, and evaluate it. So some of them didn't make it to this presentation for those reasons. So it doesn't mean that they were not good, were not fully developed. It just didn't have the pieces that we wanted to present today.
Okay. Another question here. My question is regarding the data percent shown for MSI. Did you use or see any denominator used?
We received information from, I want to say WSIB. You should right now be able to look at the Safety Check website, and that's what we use. I don't have the denominator off the top of my head, and I don't want to change my screens too much, but it looked at organizations, but only in Ontario. So the healthcare organizations and all the subsectors. So if you look at the what did we have? Our hospitals, ambulatory, long-term care, and other. So I don't have that information right now, but if you send me an email, I can get permission to send that to you.
Great, thank you.
And is it okay if I just say one more thing? I
For
just wanted
sure.
to mention for organizations that are present here or listening in, and you're a small organization, you don't know where to start. There is in BC, one of the slides we have there, it's a companion guide to BC's Handle with Care documentation. And it really helps smaller organizations understand why you're doing client handling, why you're doing a risk assessment, who's doing it. So medium-sized to larger organizations might already know all of this for a variety of different reasons, but I find sometimes the smaller organizations don't. So it's a great tool to help build that confidence and start your program.
Excellent, thank you. I'm just monitoring the chat here. So there's a comment about our health authority has the HOP 7 book. We asked the
Yeah,
library to purchase it. That may be helpful if your department doesn't approve the purchase.
that's a great idea. Thank you very much for putting that in the chat.
Mhm. And another comment here, 10 years ago, my employer ordered HOP 6 from the UK site and it was worth it.
It is, and HOP 7 is even, there are differences.
Great. Okay, one more question in the Q&A. Ask clients' mobility status. Also have been looking for bedside care or bed
Mhm.
mobility assessments specifically.
We did cover those quickly, but when you get the presentation, go to that section and there's a lot of information on those bedside ones. They just have different names. So when you're searching, there's like the mini assessment, the bedside assessment, all of those different titles that mean the same thing. So when you go to that assessment piece, just look at for the right links.
Great, thanks, Sandra. Okay, so that concludes the Q&A session. Thank you for joining us today, everyone. I look forward to seeing you at our next event, and please check the events page on the CRE-MSD website for the list of upcoming webinars and events. And you can find a lot of resources and links to past webinars as well on the client patient handling page. Finally, if you haven't had a chance yet, we encourage you to visit the MSD Prevention Guideline for Ontario website at msdprevention.com. Here you can find a wide range of resources designed to support workplaces with MSD prevention. Have a great day, everyone.